Hello, I'm Shahal.
And I'm Gaisha, and we are parents of an autistic child. Uh, Thank you, Shehal, for agreeing to do this because I'm really camera shy. So let's start with looking at when Suhedi was diagnosed and the process of getting diagnosed. So our midwife actually flagged at 15 months, right, that she may be at risk for autism because she lacked eye contact and she wasn't
responding to her name.
Yes. And what followed afterwards is we went and consulted multiple doctors.
Developmental pediatricians, neurologists, and so on. And we got a neurodevelopmental delay diagnosis from Lady Ridgeway Hospital at 15 months. At 18 months, we got another diagnosis based on ADOS2 toddler module.
Yeah, so that was the autism diagnosis, like the official autism diagnosis diagnosis that we got.
Yeah.
So, what are we going to talk about today?
So, this is our 8th year into a parenting journey of a special needs child. This is also Autism Acceptance Month. So we would like to talk about how we can build a neurodiversity affirming world for our child.
Okay, so what is meant by neurodiversity?
Neurodiversity refers to how the differences in how the brain functions. The diversity is neurological. There are no structural or anatomical defects in the brain. So the diversity is purely neurological.
So by neurological diversity, we mean like how the brain processes thoughts, inputs, things like sound, sight, visual things, language, and also how it interacts with its environment, right?
Yeah.
So what do we mean then by neurodiverse affirming?
So neurodiversity affirming means that we acknowledge, we accept the diversity. We don't try to fix it. We don't consider it to be a disease. We don't treat it like a disease. We don't pathologize it.
Okay, so how is autism diagnosed?
In Sri Lanka, and this is our experience as a parent of a special needs child, you'll have to consult a developmental pediatrician or a child psychiatrist to get a diagnosis, and the basis will be the basis for the diagnosis will be DSM-5. Yeah.
So that's like essentially a criteria that they will refer to when coming up with the diagnosis. Was the diagnosis beneficial when it came to our child?
It was, yes. The diagnosis was how we got the accommodations our child needed, especially in school. So yeah, it was beneficial.
Yeah, so basically, I mean, even if we as parents said or felt that we needed ABC accommodations, that would not necessarily be received as well as it would be if it wasn't backed by the recommendation of a clinician, right?
Correct.
Why is calling autism a disorder or a disease problematic?
The formal diagnosis is known as autism spectrum disorder. This means that the features are presented in a spectrum rather than distinct points. The term disorder is problematic because it pathologizes the diversity.
So when the medical community approaches it as a disease or a disorder that needs a cure, it has certain negative impacts on autists, right? So let's look at some of the points that we've identified as negative impacts. So the first is the fact that the blame is placed on the innate nature of an individual. Can we elaborate on that?
So we mentioned that the diversity is neurological and it's not anatomical, it's not structural, right? So this means that when blame is put on the individual, there's nothing much they can do about it because there's no, right now at present, there's no science to back anything to say that their neurology can be changed, that they can change the way their mind works. So that is something that they will have to carry throughout their life if the burden is put on them. So that's not good.
Yeah, so basically it's like carrying an illness, right, that they have when it's really not an illness. And also the focus then also becomes on the cure, the treatment for something that doesn't really require or can't be treated or cured at present.
Correct.
So when a child is diagnosed with autism, just as much as it's the responsibility of the individual, in the case of a child, the responsibility to fix the child, the responsibility of intervention all falls on the child or the primary caregiver. Would you like to elaborate on that?
There is societal pressure on the parent to fix or to bring the child to behave like a normal or a neurotypical child would.
By pathologizing neurodivergent behavior such as stimming is seen as abnormal and socially unacceptable behavior. Would you like to elaborate a bit on that?
Yeah. So this means that it compels neurodiverse individuals to mask their behavior, and masking, especially if it's not on their terms, is very traumatic. It takes a big toll on their sanity.
So what do you mean by on their terms?
So sometimes this is what based on what autists, actually autistic individuals have mentioned, that they do mask their behavior so that it fits the norm when it benefits them. Right. So it's on their terms that they're doing it, but sometimes they're compelled, they're forced to. Right. There's pressure on them to behave in a particular way, and they're not okay with that, and it takes a toll on their sanity.
I mean, when you focus on pathologizing neurodiversity or naturally autism, it diverts the attention from the actual problem. I mean, which is that we live in a world which is created for a specific neurotype, and the systems in place just don't include or accommodate the needs of the neurodiverse community.
Yeah.
So are we saying that autism or neurodiversity doesn't require any kind of medical intervention?
No, we are not saying that. We're saying we are acknowledging that certain characteristics of autists might, medical treatment might benefit them. Yes. But as a whole, autism should not be pathologized.
How would a neurodiversity affirming world approach autism? So what we believe is that what would really help an artist is to create an environment that supports them to live their life with dignity, enjoying the same rights and privileges that everyone else would have.
So yeah, in the case of our 8-year-old daughter, if there was an inclusive education system that accommodated all her special needs, that would be a neurodiversity affirming environment.
So access to education is a child's fundamental right.
Yes.
And if it's a neurodivergent child, ideally there should be an education system in place that's both inclusive but also accommodative of their specific needs.
Yeah, so inclusion without accommodations will not benefit a child like ours.
Okay, so what do we mean by inclusion?
So inclusion means that the child is in the mainstream classroom as opposed to a special unit.
Okay, but then just because they're physically present in a mainstream classroom, if they are following a standard education plan like all the other kids, that won't benefit her either, right?
No. So they will need a individualized education plan, then trained teachers who can execute it, then a system to track the goals, alter it, and yeah.
And those would be the accommodations.
Those would, correct.
Okay. What are some things you can think of that you wish you had known when you were starting out your autism parenting journey?
I think spending a lot of time and effort trying to understand why this happened to us.
Yeah, I think I did that a lot. Like, I would spend hours, like, after everyone goes to sleep, just trying to figure out why this happened, how this happened, who's to blame, what could I have done differently, why this is happening to us. And there are no answers to that, right?
Yeah, I think it's primarily because we treat autism as a disease, and we didn't have that insight on neurodiversity back then.
And also, like, when it's treated as a disease, you're looking at it like, okay, this is the root, like, you need to find out the root cause, because if you don't find out the root cause of it, how are you going to find a cure to it, right?
Yeah.
So you're like, okay, what could be causing this, and then how am I going to fix this? Which goes on to the next issue of, like, trying to fix her, right?
Yeah. So try not to spend again time and effort on trying to fix her, as opposed to using that energy, that effort to trying to understand her, because I try to understand her diversity, try to understand what she's saying, what she's feeling.
Yeah, because that's a lot of societal pressure again coming in, like, especially when they're younger. There's like always this room for improvement or room for change. Like, you live in the hope that things will change, and then you think, okay, let's focus. Like, in our case, it was getting her to talk, right? So drill, therapy, and see, like, can we, like, sort of push the words out of her, and like her mental well-being actually was kind of put into the back burner. We weren't really thinking about how is she responding to this. And then
So the other one is we should have spent a lot more effort. We did, but I think a lot more on deflecting some of the research, like doing your own research, because there's a lot of suggestions and opinions coming in. So doing your own research, because you know your child best. You should see what actually works for you, as opposed to just blindly following random opinions and
I think even when it comes to professionals in the field, like, sometimes you need to validate and check, right? Because it's not that the opinions are coming from a bad place, or maybe not even coming from a place where it's not researched, but it's just maybe something that's just not going to work for your child. I mean, this is a spectrum.
Correct.
So certain things that worked for like maybe like 20 kids who the therapist was seeing may not be working for her, and then you need to like understand that this is not like, you know, administering some sort of treatment or medication and there will be an outcome. Like you need to understand that you have, if it's not working, do some research, see maybe there are other people who it didn't work for. Then you know not to waste your time, like, you know, putting everyone through trauma, like, you know, just for that purpose.
And also, you know, to listen to actually autistic people, what they have to say.
And also, I think now, like, there is definitely more of a platform for autistic people on social media. Like, there are so many like artists, like even like in our case, our focus is on speech because our child has a speech impediment. So even like you get autistic individuals who have had speech impediments, who have either outgrown it or like overcome it, or some who are still living with it and have found other forms of communication. So I think listening to those autistic people really helps, but also listening to your own child, right?
Yeah, correct. And then because they speak, they communicate in multiple ways, in cues, gestures, in how they interact with you. It's all part of communication. So there, you know, you have to spend more time on that, understanding what they're saying, validating what they're saying. Sometimes, you know, it's a bit difficult when they're not, when you can't figure out what they're saying or what they're feeling. So spend a bit more time.
And even with spending time, I think we kind of like when you're sometimes you can spend all the time in the world and still not understand what they're trying to communicate, right? I mean, we have so many times where she's having an epic meltdown. We're seeing that these days as well, and we don't know why. Like, where people are asking us what's wrong, and we also don't know.
Sometimes.
And I think that's also something, that's also part of accepting this, and then accepting there are times where nobody's really going to know why it's happening, but then I think being present and being able to be there for her, and then maybe trying to make her feel heard regardless, and say we're there for her, that in itself helps, you know, with whatever she's going through.
Correct.